Osteoporosis is a metabolic bone disease, and that will cause porous bone appearance. Some would call that bone looks like Swiss cheese. What happens after that, then bone lost the mineralization, it also will lose the strand. So bone density is decreasing at this time. Osteoporosis is a disease of multifactorial origin, and first of all, age would affect. Age-related bone loss will happen equally in men and women, but mostly women experiencing severe negative consequences of osteoporosis, such as fractures and risk for fracture in postmenopausal women are severely increased. Another option or another factor that can affect the development of osteoporosis is immobility. So if patient had for some reason decreased the activity level, they may experience osteoporosis, although they don't have any other factors that may contribute to it, such as age or female gender. When a woman becomes estrogen deficient after menopause, it may result in loss of density, inability to retain and absorb calcium, and osteoporosis. The recommendations, of course, will be not only introduce estrogen, and introduction of estrogen, as we know, it's rather controversial at this point. So again, the hormone therapy, it's very controversial, and we'll talk about it in the future. But one of the safest recommendations will be to introduce exercise, weight-bearing exercise, which can slow the progression of the osteoporosis. So when osteoporosis occur, patient may have consequences related to compression. Vertebral fracture in the spine may occur, and tiny wrist fractures. So compression fractures are common, and because of the compression fractures in the spine, and patient may have decrease in height, and at the same time they may develop a hump, Dauger's hump. So that's an abnormal curvature in upper thoracic spine. Again, wrist fractures may occur, and as the disease progresses, the most undesirable consequences of it, the risk for it increasing, and the most undesirable consequence is the fracture of the hip or a fracture of femur. Also, patient may have very easily, they may fracture the distal radius. The statistics about this rather overwhelming, and they do not change much even with the introduction of the medications like Boniva and Fosamax. They do not change much, and approximately 1 million fractures a year may occur annually in the United States. And by 1 million fracture, I mean hip fractures. Hip fractures will occur in older women, again frail, older, and hip fracture may result in increased mortality. However, as I said before, advanced techniques of the hip replacement may result in gaining mobility back and basically preserving that life and providing good quality of life. Treatment for osteoporosis is existing, but treatment would not be reversing the osteoporosis completely. However, the treatment can level the bone mass and can maintain adequate level of bone mass. So administration of again medications such as Fosamax, Actonel, Boniva, and Reclast can be helpful. And Reclast is actually in once a year injections, which is very convenient for the patient, and the same is Boniva can be done once every 3 months, and Fosamax and Actonel can be done depending on the regimen, daily or once a week. So the treatments certainly are existent, but they wouldn't really reverse the osteoporosis. They still prevent it from development. Of course, with osteoporosis treatment, also the consumption and adequate amount of calcium is important. So besides the calcium, we need to have adequate vitamin D intake and also weight-bearing exercise routine. So swimming per se do not benefit osteoporosis prevention. Swimming is non-weight bearing exercise, so it will be good for cardiovascular fitness, but as a mean to prevent osteoporosis, it will not be of such a benefit. Estrogen, again, therapy may be of benefit, but it's controversial. It's certainly there is a strong relation between breast cancer and estrogen therapy, hormone replacement therapy. So again, and we will talk about it more when we talk about hormone replacement therapy. The decision should be made on case-by-case basis, and the patient has to be very, very involved into making that decision, and informed consent has utmost importance in this. But to be on the safe side with all of this, you certainly may recommend daily exercise, daily weight-bearing exercise to your patient. Also vitamin D, calcium, and medications also may help. And osteoporosis can be controlled, and the result will be prevention of hip fracture, and the result will be reduction of related quality of life impairment and reduction in overall mortality. Let's look closer on postmenopausal osteoporosis, and I'd like to do that because this is one of the most common types of osteoporosis, and postmenopausal women are much more commonly affected than their male counterparts, the males of the same age. So to understand this, we need to realize or recall that serum androgens will affect bone density. The androgens cause bone density to increase. So androgens such as testosterone or dihydrotestosterone will stimulate bone formation. When we thinking about this, then it becomes somewhat paradoxical. Well, if we are talking about androgens, why decrease of estrogen is so concerning. In this case, there is a rather simple explanation. Decreased level of estrogen will cause increase in aromatase or aromatase, which is an enzyme that converts testosterone to estradiol. So if we have dropping estrogen, the patient also will develop increased level of aromatase, and testosterone will be aggressively converted to estradiol, and which will result of losing the intensity of bone formation compared to a female who hasn't been exposed to significant amounts of aromatase. So another cause will be progesterone deficiency, and progesterone deficiency may be related to osteoporosis, and this can be caused by changes in osteoprogerin, which is an insulin type like growth factor, and we have this short abbreviation IGF, which is a combination of deficiency in osteoprogerin and deficiency of calcium intake, deficiency in vitamin D, magnesium is missing already, and not enough weight-bearing exercise. In addition to that, we have estrogen levels dropping, which will drain our androgens as well, and plus we shouldn't forget the important factor like family history. So all of this can work together and cause osteoporosis in postmenopausal female. To add to that, there is another risk factor that can affect postmenopausal female: the excessive use of sodas. And sodas are like laced with phosphorus, and they will interfere with calcium phosphorus balance, and which will also result in osteoporosis. So to summarize, we have, in this case, we have deficiency of testosterone secondary to increase in aromatase, which is related to declining estrogen level, and another cause, the progesterone deficiency, and progesterone deficiency is related to reduction in osteoprogerin, and which is an insulin growth type factor. In addition to that, we have not enough calcium, not enough vitamin D, decreased magnesium, not enough exercise, and we also have excessive intake of phosphorus containing drinks or foods, and all of this together will result in brittle bones. But again, don't forget that this all, like food and intake or dietary intake, may not be the main source of development for osteoporosis. This is a worldwide problem, and it's certainly one of the main causes for it. It's not dietary related, but it's related to deficiency of androgens and deficiency of progesterone. But of course, having not enough calcium, vitamin D, not enough exercise, and drinking too much sodas definitely will make the situation even worse. But again, don't forget that the male person who does exactly the same may not develop osteoporosis at all.